This, we are now joined by the head of risk communications at National Center for Disease Control, Dr. Yahaya Disu. I mean, good to have you, Dr. Disu.
Thank you for
the figures are, as rolled out there by Dr. Ibekwe are quite worrying. However, some Nigerians still are unaware about this disease. Let me ask you, what is the major cause of meningitis?
The major cause of meningitis could be viral, could be bacterial, but the one of epidemic proportion is bacterial meningitis. It is one that is caused by meningococcal organisms. And that has been a major issue. We have some meningitis belts across African continent, and many northern states in Nigeria are in that belt, and some few states in the southern part of the country.
Is it contagious? And let's talk about one of the respondents there talked about, a doctor, understanding the roles that people should play towards curbing this particular disease. So is it contagious, first of all? And what are those roles that people have within their own control to play to curb this spread?
Yes, it's a contagious disease because it's caused by bacteria, but it is spread by droplets, just like COVID.
Yeah.
So that means you need to avoid overcrowding, close contact, especially when you see people who are sick, and then try and avoid then issue of hand hygiene, regular hand hygiene, because somebody who has meningitis, who sneezes, can contaminate surfaces. So when you touch the surfaces, all the droplet can drop directly on someone's body. So that's why we need to promote hand hygiene, and then to also ensure that the social distancing can also be helpful. Maybe this is a terminology that is becoming also
COVID-19.
Yes. Okay. Yeah. So one of the benefits of COVID-19 is it has woken us up. Everybody is conscious of the health system and what they need to do. And then usually during outbreaks like Ebola, COVID-19, you usually have low reports of other diseases, especially diarrheal diseases, because of the general hygiene measures that have improved. So.
Right. I mean, still on meningitis, like sepsis, the World Health Organization says it affects, children within the age of 5 and below. Why is this so?
Because the one you're talking about, it's more or less viral meningitis, and then those children, their immunity is still very low, and then they are just developing, and then meningitis is actually affecting the covering of the brain and the spinal cord.
Right.
And then when that inflammation occurs, and then it's, this is a vital organ in our system that speaks to our survival, our functionality. Anything that affects them at that stage in life will have long-term sequelae, like disability, hearing loss, deafness, and so on. So for that is what you can see anywhere in the country, right. Anywhere. But when it comes to bacterial meningitis, you have meningitis belt, because this occurs due to low humidity, high temperature, overcrowding, those factors that can facilitate its spread. And there is a particular period of the year that we usually see this in particular locations, usually December to June. It disappears with the appearance of rain, beginning of rainy season. Yes, it's a major factor. Yeah, it's a major factor.
You were talking about sickness a while ago there. Why is it that, from that report, I was saying that it's surprising that so many people do not know about this particular disease, meningitis. So why is it that people do not know about this disease? And then there is the danger of confusing it, I read, with flu, malaria, and then, of course, COVID-19. Can you talk about that?
Now, there is a general factor which has to do with consciousness about our health. Generally, it's not just about meningitis that people don't know about. Probably most people just know about malaria and typhoid fever and so on. So what is important is in health education, in our schools, in activities that we do, if we incorporate health education into what we do, it gives us opportunity to begin to think about our health in everything that we do. And that cannot translate into other things. But with regards to meningitis, because this is a disease that has impact on our economy, impact on society, and impact on lives. And we need to create awareness. And then what government is doing, what people need to do, what people need to know about the disease, how it is spread, and how they can protect themselves.
The symptoms, what's the difference between the symptoms and that of flu, malaria?
I know, usually, when you look like any other disease, you have fever, headache, nausea, cough, and then sneezing. And then for meningitis, there's what we call neck stiffness. The neck becomes very stiff. And then again, sometimes light sensitivity, and somebody doesn't want to see the light and all those things. Then vomiting, general symptoms you can see, but for meningitis, neck stiffness, neck pain, backache, and those things are things that can point to whether this is meningitis or not.
All right, we'll leave it there. For now, Dr. Yahaya Disu, thank you for being on Newsnight.
Okay, thank you very much.